I'd like to welcome to the podium Kathy Bates.
Thank you, Bill. We're in the midst of a struggle which has been called the silent epidemic. Lymphatic diseases that affect upwards of 10 million Americans, more than muscular dystrophy, multiple sclerosis, ALS, Parkinson's, and AIDS combined. Our struggle will take longer than we can imagine. It'll take great effort and tremendous patience to endure the fight to educate the public and the medical community, and most of all, to raise the enormous amount of money needed for research to solve the mystery of these diseases that cause an estimated 140 million people around the world to suffer. I have lymphedema. I developed it right after a bilateral mastectomy almost 4 years ago. I knew that what lymphedema was because my mother had it way back in the 70s. And I had seen her arm swell to twice its size. And there was no treatment in those days. I don't even know if we referred to it as lymphedema. She had a radical mastectomy, and that was sort of, that's what happened. But I watched the lymphedema slowly defeat her spirit. It's silly to talk about, but she always dressed really snappy and nicely. She bought nice clothes, and suddenly she couldn't do that anymore because she couldn't get her arm in the sleeve, and she had to wear clothes that she wouldn't have been caught dead in, no pun intended, years before. So as her daughter, when I was facing a mastectomy, I was terrified that I was going to get it, and I pleaded with my surgeon, if the sentinel node's clear, just get out. Don't do anything else. Those first couple of days when I was recovering in the hospital, I could feel these strange feelings in my hands and in my forearms. It wasn't due to any of the intravenous stuff they were using. It was just something else, and I thought, this is it. This is the lymphedema. This is what's happening, and I was right. And I just felt trapped in a body that I didn't want to be in anymore. And I felt betrayed, and I was filled with hate and bitterness, and this went on for quite a while. But then one of my surgeons arranged for me to meet with Dr. LE&RN. And there are just some doctors that can heal you without touching you. And after listening to me go on and on and on about how unfair it was and how my life was over, she said in her charming Eastern European voice, she said, "My dear, you are still very young. I have patients 100. I have one who is 105. She dresses always in Chanel. And if you want to know about the stock market, you ask Martha." And then she said, "Have a glass of champagne and begin your new life." And so I have. Now at LE&RN, we try to help these people who have suffered needlessly for years. We encourage them to come out of the closet, so to speak, to share their stories and hopefully find some comfort in realizing that they're not alone. We listen and we empathize. Sometimes we're able to guide them to clinics. Dr. Stan Roxon at Stanford has a wonderful clinic. He treats about 600 patients a year, which I think is phenomenal. He has a photo on the wall in his office of an ostrich with its head in the sand, depicting the medical community. I just love that. And I hate what it represents. This is the crux of my frustration. I don't understand why medical schools find it unnecessary to spend more than a couple of hours talking about lymphatic diseases. I cannot accept that doctors can't be taught to diagnose and treat people who are suffering, to diagnose LE promptly at an early stage when it can still be managed. GPs are the first line of defense. If nothing else, that's my goal, to bring attention so that every single doctor in the country knows what this disease is, how to diagnose it, and knows where to direct their patients for professional treatment.